After the birth of her infant, a mom has the choice to feed her baby through breastfeeding or through formula. And we'll talk about the benefits of breastfeeding and the option of formula feeding as well. If a mom does choose to breastfeed, she has some certain requirements for nutrition during lactation. So breastfeeding increases energy costs for a mom by 500 calories a day during the first 6 months of lactation. So to meet this excess demand or this excess cost, the mom should get about 330 calories from her food, and then 170 calories should be drawn from her store. So she shouldn't consume an extra 500 calories a day. She should just sort of let it balance out between a little bit of excess food consumption and then drawing from her nutrient stores. Fluid needs are also increased during lactation. So a mom produces about 25 ounces of milk per day. So she needs plenty of her own fluid needs to prevent dehydration and to produce plenty of milk for her child. The nutritional deprivation of a mom reduces the quantity but not the quality of milk. So even if a mom is not consuming enough of a certain nutrient, her body knows to draw from the nutrient stores of that specific vitamin, mineral, whatever, and it will put that into the milk at the expense of the mom's nutrient stores. So an example might be calcium. If a mom isn't getting adequate calcium in her diet, then her body will draw calcium from her bones and put that into her breast milk, and then her child will get it. So even if a mom essentially would starve herself, her milk will adapt to provide plenty of nutrients for her baby. Breastfeeding also can help to determine food sensitivities and food allergies of a baby. So, if a mom had consumed super spicy food, that may actually go into her breast milk and could upset the stomach of her child. But exposure to different foods, flavors through breast milk can actually help to reduce food allergies later in life. A lot of moms want to breastfeed because they've heard that it can help with weight loss, and this is true. Gradual weight loss of 1 pound per week is safe and does not reduce milk output, but if a mom were to reduce her energy intake by a lot, this will inhibit lactation. So remember that up here, that energy cost of lactation are 500 calories a day. So if a mom were to decrease her intake much more than that, she would definitely probably inhibit her lactation. So most moms it's recommended to breastfeed, and we'll talk about who recommends and why. But there are some certain cases when a woman or a mom should not breastfeed. For any moms that use alcohol or illicit drugs, definitely do not breastfeed, or do not breastfeed immediately after using any of these. Alcohol concentration peaks within an hour, so you wouldn't want to drink a glass of wine or a beer or whatever and then immediately feed your baby. So you might have heard about people pumping and dumping. So if a mom wants to go out, have a glass of wine, she would breast pump and then throw that milk away and then not feed her baby that milk. She probably had extra stored from earlier, but you wouldn't want to give your baby anything that would have a chance of having alcohol in it. And illicit drug users should not breastfeed altogether. Tobacco should also be avoided, as women who smoke produce less milk altogether, and their milk that they do produce has a lower fat content, and this can result in less infant waking, which is not a good thing. As we talked about before, caffeine should be consumed in moderation. Some medications may be secreted in breast milk, so you'd want to check with your doctor about, what is safe to consume or safe to use during pregnancy and during breastfeeding. And is there an alternative that would be safer if not? Environmental contaminants could be a contraindication for breastfeeding, and then certain maternal illnesses such as HIV or untreated tuberculosis, these moms should not breastfeed unless they're in, say, a developing country where it may not be safe to mix formula with water. Rapid growth and development during infancy depends on adequate nutrient supplies. So during the first year of life, a baby grows faster than they will during the rest of their life. By 5 months, birth weight has doubled by 5 months, and it triples by 1 year. And the length of a baby increases by 10 inches in 1 year. So when else do you grow 10 inches in a year? Never. Only in your first year of life. In the second year, the infant only gains about 10 pounds total and another 5 inches. So there's still a lot of growing going on in those first couple years of life, but the first year of life is the most growth that's going on. Basal metabolic rate is very high during infancy due to this rapid growth and development, especially in the first year. So nutrients of extra importance, of course, everything is important, but these are the nutrients of excess or of extra importance. So carbohydrate, fat, protein, so all of our energy-yielding macronutrients, vitamin A and vitamin D, calcium, and water. Water we want to prevent dehydration, and then vitamin A, D, and vitamin A is important for growth for sure, and then vitamin D and calcium are definitely important for bone health and growth and development. So let's talk a little more about breastfeeding recommendations. The American Academy of Pediatrics and the Academy of Nutrition Dietetics recognize exclusive breastfeeding for 6 months and breastfeeding with complementary foods for at least 12 months as an optimal feeding pattern for infants. So if a mom can breastfeed, it's really recommended that she should. And why is this? Breast milk is nearly the perfect food for infants. It contains all the macronutrients in proper amounts, and it's easily digested by infants. So we're going to talk a little bit about these macronutrients that it's supplying and then some of the other nutrients that are included in there as well. So lactose, remember, is a carbohydrate, and lactose, which is found in breast milk, will help to enhance calcium absorption. Lipids are providing the main source of energy, and breast milk is providing essential fatty acids in the form of arachidonic acid and DHA. Both of those are very important for brain health. Lactoferrin is a protein that aids in iron absorption. And overall, breast milk excels as a source of nutrients with the exception of vitamin D. So for infants that are exclusively breastfed, a vitamin D supplement is needed. Remember that iron stores are good in an infant for up to 6 months. They have iron to last them up until 6 months. So after 6 months, in babies that are exclusively breastfed, they will need an iron supplement in addition to that vitamin B supplement or vitamin D supplement, because iron is not found in breast milk or any milk for that matter. But formula would be iron fortified. If water is not fluoridated, a fluoride supplement may be needed. And then vitamin K, a single dose is usually given at birth to help promote the intestinal health of an infant. Some other benefits of breast milk: it contains immune factors. So colostrum, which is produced in the first 2 to 3 days of lactation, helps to protect the newborn from infections because it has antibodies and white blood cells in it. So basically whatever the mom has been exposed to and she's developed antibodies against whatever illness, she's going to pass it on to her baby, and then that baby will likely be protected as well. Babies that are breastfed have fewer intestinal infections, they have fewer ear and respiratory infections, they have fewer allergies and less incidence of asthma, and they have a decreased risk of sudden infant death syndrome or SIDS. There are some other potential benefits that it's thought breastfeeding may provide, but these are not proven. There is some evidence, but not enough to say like yes, this is true. So breastfeeding may protect against excess weight gain later in life. So some studies show that infants that are breastfed tend to be, more of a normal weight in adulthood. And it's also thought that breastfeeding may influence intelligence. So babies that are breastfed have higher grades or higher intelligence than infants that are formula fed. That may be true in some cases, but again, there's not enough evidence to completely say this is true. So for women who cannot or do not wish to breastfeed, formula feeding offers an acceptable alternative to breastfeeding. Infant formulas are designed to resemble breast milk, and they are fortified with iron and vitamin D. So if an infant is formula fed, they don't need that iron supplement and they don't need that vitamin D supplement because the formula is already fortified. So formulas are basically made to be as close as possible to breast milk. However, thinking about those immune factors that are coming from mom, obviously those cannot be put into formulas because we don't even know what all is in there. So that's somewhat of a disadvantage for formula feeding, but formula feeding is an acceptable alternative, and it's going to provide everything that is needed for the infant to grow and develop properly. Special formulas are available for premature infants, so these premature infants may not even be able to tolerate breast milk because they just haven't developed completely. Infants that have allergies and other health issues, there are special formulas out there. Cow's milk should not be given to any infant less than 1 year of age. Like breast milk, it's a poor source of iron, and the higher calcium in cow's milk, and then it has no vitamin C in it, will inhibit iron absorption even further. So we know irons after 6 months, iron stores in an infant are already decreased, so we don't want to decrease that anymore. After 1 year, it's fine to replace formula or breast milk with cow's milk, but you want to start with cow's milk that does have some fat in it. So do not use skim milk to start, because you don't want to restrict fat intake, because that's very important for growing children. So you can see in this table here just the comparison of breast milk, formula, and cow's milk. Foods can be introduced when the infant is physically ready to handle them around 4 to 6 months of age. So you can look at table 13.3 for signs of readiness of when a child is ready to try some of these foods. And addition of new foods should be governed by 3 considerations. These are nutrient needs, specifically for iron and vitamin C, physical readiness, swallowing ability, and we want to avoid foods that are choking hazards, so cut in small pieces or round foods, those prove to be choking hazards. And you need to detect and control for allergic reactions. So it's good practice to introduce single ingredient foods one at a time, and then wait 4 to 5 days before introducing the next food. So if an infant has some sort of allergic reaction, you can really narrow down what food caused that reaction. Infants can consume food from all food groups, and they should. Food should provide a variety. They should be provided in balance, and they should be all provided in moderation. And it's important to practice food safety principles. So again, just like we all need the same nutrients regardless of what life stage we're in, we all need to practice variety, balance, and moderation, and we all need to practice food safety principles. Foods should be limited or omitted, including sweets and sugar, alcohols. These are just providing energy-dense empty calories. And then if you expose more sweet foods, the child is going to have an increased preference for those, and then that could replace healthy, nutritious foods later on down the road. Canned foods, honey, and corn syrup all may increase the risk for botulism, so those should be limited until the child has developed plenty of antibodies. And again, you shouldn't give honey to an infant less than 1 year of age. We want to limit the amount of milk we give because we know it's iron poor, and too much milk can interfere with iron absorption due to the calcium, and this can actually cause milk anemia. So the first year of life is really important in health because it lays the foundation for future health. So it's important to encourage healthy eating habits. As a parent, or even an older brother and sister, setting good examples, because the child will want to mimic your behavior. Avoid concentrated sweets, as these are, again, providing empty calories. They're very energy dense, so they're not really providing anything of value to the child. You do not want to use food as a reward because that just sets up a bad practice later on in life. Encourage physical activity. And then you want to avoid putting an infant to sleep with a bottle, regardless of what's in the bottle, even if it's breast milk, formula, juice, soda, whatever. Putting an infant to sleep with a bottle increases the risk for tooth decay and can cause some symptoms of what's known as nursing bottle syndrome.